Why do bladder cancer types look different under a microscope? Imagine looking at a tiny world where each cell tells a story about its origin and behavior. When pathologists examine bladder cancer under a microscope, they see a variety of different patterns and structures. These differences happen because each type of bladder cancer arises from different cells or has undergone unique changes in how the cells look and grow. These microscopic features help doctors understand the nature of the cancer, including how aggressive it might be and how far it has spread. Most bladder cancers start from the lining of the bladder called urothelial or transitional cells. But even within this group, the cancer cells can look quite different. Some may resemble normal urothelial cells but with some abnormal features, while others might look very different, resembling other types of cells like squamous, glandular, or neuroendocrine cells. These differences are called divergent differentiation and are important because they can influence how the cancer behaves and responds to treatment. The way tumors grow also affects their appearance under the microscope. Some bladder cancers grow outward in finger-like projections called papillary tumors. Under the microscope, these look like branching structures lined with abnormal cells. Others grow flat along the bladder lining without forming projections, known as carcinoma in situ or flat tumors. Microscopically, carcinoma in situ appears as high-grade abnormal cells spread across the surface, often with very irregular shapes and large nuclei. The grade of bladder cancer refers to how much the cancer cells differ from normal cells. Low-grade tumors tend to look more like normal urothelial cells, with organized structures and less nuclear abnormality. High-grade tumors, however, show marked differences, with cells that are irregular in size and shape, and they often divide rapidly. These features are easy for pathologists to spot and indicate a more aggressive disease. Another key factor is how deeply the cancer has invaded the bladder wall. Non-muscle invasive tumors stay confined to the inner lining, while muscle-invasive tumors penetrate deeper into the bladder tissue. Under the microscope, invasive cancers often show signs like dense fibrous tissue around the tumor, called desmoplastic reaction, or spaces around tumor nests caused by tissue processing, known as retraction artifacts. These features help determine how advanced the cancer is. There are also rare types of bladder cancer that have unique microscopic appearances. For example, squamous cell carcinoma, adenocarcinoma, and small cell carcinoma each have distinct features reflecting their cell of origin. Even within the common urothelial carcinomas, there are variants like micropapillary, plasmacytoid, or sarcomatode types, each with their own microscopic signatures. In essence, the reason bladder cancer types look different under a microscope is because of their cellular origin, how they grow, how abnormal they are, how deeply they invade, and whether they belong to a specific subtype. These microscopic differences are crucial for accurate diagnosis, prognosis, and choosing the best treatment. Pathologists carefully examine these features to classify bladder cancers correctly, which ultimately guides effective bladder health management. If you or someone you know is dealing with bladder issues or concerns about bladder cancer, always consult a healthcare professional for personalized advice and proper diagnosis.